Good evening, and it's great to have you with us here on a very busy Thursday night. And we begin tonight with that troubling news on the coronavirus here in the U.S. The South African variant of the virus that we knew Dr. Anthony Fauci has said he was concerned about has now been found in 2 people in South Carolina. Neither had traveled, and they had no connection to one another. Tonight, scientists believe this strain is highly contagious, and the other concern is that it would appear that the vaccines aren't as effective in fighting it. Moderna, for one, already announcing they're developing a booster to make their shot more effective against this variant, though that will take time. Pfizer says it's hard at work on this, too. Tonight, the virus has now taken more than 431,000 lives. This January has been the deadliest month yet. With news of that South African variant here, the CDC tonight is now urging people not to travel. And this evening, all of this comes amid efforts to get more vaccine out there and news that some vaccine is not being used. That new note from the CDC saying at least 13 states have used less than half of the vaccine doses sent to them. ABC's Whit Johnson leading us off tonight.
Tonight, the first known cases of that highly infectious COVID variant from South Africa now confirmed in the U.S. 2 people from South Carolina with no travel history or connection to one another.
What is your biggest fear?
My biggest fear at this moment is that these variants are going to take hold and really take off across the United States. And if that happens, we're going to see a huge spike in cases, lots of infections, lots of deaths.
The CDC now urging all Americans to avoid travel. It's exactly what experts worried about, since early tests showed the South African variant may chip away at the effectiveness of the Pfizer and Moderna vaccines.
The one in South Africa, George, troubles me.
Dr. Anthony Fauci telling us work is already underway to update those vaccines with a booster shot.
We'll already be on the road to being able to give people a boost that directs against the South African isolate. That's what we're doing right now. So we're not taking any chances.
There is no evidence the South African variant is more deadly, but it does spread more easily, like mutant strains from Brazil and one from the UK already in 28 states. Our Will Carr is in California, where they are on alert looking for the South African variant, too.
Labs across the country, including here at Stanford, are on the hunt for the variant from South Africa. They haven't found it yet, but they say it's only a matter of time.
I think we should assume that it's in other places as well. It may still be low in total number of cases, but I do believe it's probably much more widespread than just South Carolina.
With new variants threatening a fresh surge in cases and more deaths, growing pressure to vaccinate with limited supply. Some states like Washington cracking down, telling non-residents there's no vaccine for them. This man drove from Oklahoma to get one.
I set my mileage at 0 miles when I left. I drove almost 1,800 miles in 2.5 days.
In Oregon, county health workers stuck in a snowstorm managed to save 6 doses that were about to expire, setting up an impromptu clinic going car to car, administering shots to thankful drivers stranded on the side of the road.
It wouldn't have mattered if it was 6 doses or 1 or 200. We would have been out going door to door until we couldn't give them anymore.
Well, that's really something. Whit Johnson with us tonight from that mass vaccination site at the Javits Center here in New York. And Whit, you've been reporting here over the past several days, the long lines across the country, families trying to make appointments for vaccinations, they can't get them. And then today we learned this from the CDC. They're reporting that 13 states have used less than half of the doses distributed to them. How is this even possible?
Well, David, there are a variety of problems, and one complicating factor is that many healthcare facilities are actually holding on to those second doses until they know that more is on the way. A senior White House advisor is now promising that fixes are in the works, including plans to ship out 10 million doses per week over the next 3 weeks. David.
All right, Whit Johnson leading us off tonight. Whit, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.